little sticky note, end poverty, right? And to this day, it's right next to the computer screen. When I'm in the Capitol, it's the first thing I see in the morning, last thing I see in the evening. And I really do think we have the power to drastically reduce child poverty and improve Oregonians' health and well-being.
Today, we've invited legislators, pediatricians, early learning hub directors, chief medical officers, and other CCO leaders to discuss how we can build on the success of the CCO model by investing more in the first 1,000 days of life and take Oregon to the next level in healthcare transformation and innovation.
Last year, there were just over 39,400 live births in Oregon. Over 43%, 17,000 births were on Medicaid, cared for by our coordinated care organizations. People on Medicaid are, by definition and eligibility, facing some degree of economic stress and uncertainty that science tells us is detrimental to healthy brain development.
Just building on what Governor Kitzhaber said, it's just convinced me about the incredible good that the early investments will play in a child's life, right? In the halls of the state capitol, we have an imperative to do these upstream investments and not continue to treat children as an afterthought.
What I'm interested in exploring is what are those most cost-effective interventions, not just in health, but particularly in economic mobility, in the physical environment and neighborhood, and the social and community context that we collectively can seek to address and incentivize payers to cover or support that we know will reap dividends down the road.
But we do know it's kind of a pay now or pay later approach, right? We pay now and really get upstream investments, give children the best launch they can have, or we pay later through the foster care system or juvenile justice agency.
I think by far, whatever initiative we do, whether it's at the prenatal or in the 0 to 5, whether it's CCO and hubs working together, it has to be driven by the local community and their input.
And I go to national conferences and I'm like, who has figured this out? And they're like, you know who you should look at? Oregon. Every time. I say that to say we really could be an innovator here. We really could lead an entire nation to figure out how to get this done after decades of research and listening to community partners has told us we need to.
So happy to see that pediatrics isn't being left behind, because it's always been left behind and it's always been discounted. And I mean, it's currently discounted. Our OHA rates are discounted for kids 6 to 18, 60%. So
Yeah.
We're already doing that. I mean, we need to change. And so this is great.
The CCOs have to be at the table and leading these conversations. When it comes to dollars, it's always the question, because childcare, how do you afford it? This is where we as a state, I think, have to learn how to prioritize this work. It shouldn't be left out, or the last thing we think about.
Rep. Reynolds said, we pay now or we pay later. I think the part that you left out is if we pay now or we pay 5x, 10x later. So often I see adults that have suffered the consequences of those childhood things that weren't addressed.
When you're in preschool, when you're in childcare, when you're in the K-12 system, and your child in your class needs behavioral health care counseling, you can't bill Medicaid for that because it's educational. And right now there's a shortage in that funding. And wouldn't it be great if we could have medical folks in those situations?
I think most of us in the room would agree that we need to bake in, is kind of how I think of it, bake in some measures that truly prioritize the needs of our pregnant Oregonians and our youngest families.
We got a lot of work to do, don't we? But it's good work. It's important work. It's work that needs to happen.